Random House Audio presents The Spectrum, a scientifically proven program to feel better, live longer, lose weight, and gain health. I'm Dr. Dean Ornish, with guided meditations by Ann Ornish. I just had a piece of chocolate, dark chocolate, really high-fat gourmet dark chocolate. It was delicious. I have a little chocolate almost every day. Now, you may be wondering if I'm cheating on my very own diet. Well, no, I'm not. I'm enjoying my very own diet. I'm writing this book to help you understand that you have a broad spectrum of choices when it comes to what you eat, how much you exercise, how you manage stress, and how you live. It's not all or nothing. This is a book about how to enjoy life more fully while enhancing your health and well-being. It's based on our latest research showing that you can actually change how your genes are expressed just by changing what you eat and how you live. In short, this book can empower you to transform your own life. You know, by now, many people are thoroughly exasperated by the seemingly contradictory information they read about what a sound nutrition and lifestyle program should be, and nowhere are the claims more conflicting than in the area of diet. Fortunately, at a time when people are more confused than ever, there's an emerging consensus about what to eat and how to live. Now, for the first time, it's possible to cut through the confusion and to personalize a diet and lifestyle program that's just right for you based on your own needs and preferences. You have a spectrum of choices. The most common misunderstanding about my work is that I recommend one really strict diet and lifestyle program for everybody. It's understandable why so many people believe this, because many of the media stories on the work that my colleagues and I have conducted have focused on our research showing that heart disease and other chronic diseases can actually be reversed just by making comprehensive changes in diet and lifestyle. Reversing a disease does require the more strict version of the diet and lifestyle program than if you're just trying to feel good and stay healthy. However, for people who aren't sick, I recommend a spectrum of choices. In this book, I'm not trying to get you to do or to not do anything. Food and lifestyle choices are deeply personal decisions. But having seen what a powerful difference changes in diet and lifestyle can make, I want to share these findings with you so you can make intelligent choices in what you eat and how you live. How much or how little you want to change, if at all, is entirely up to you. What makes this book unique is that it's based on 3 decades of research proving what works, what doesn't, for whom, and under what circumstances. My colleagues and I at the nonprofit Preventive Medicine Research Institute have proven that this program works to help prevent and even to reverse the progression of the most common and most deadly diseases. These include coronary heart disease, prostate cancer, and by extension breast cancer, diabetes, hypertension, obesity, and many other chronic diseases. We learn what really works to motivate people to make and maintain comprehensive lifestyle changes in the real world. We've consistently shown that our program can motivate people to make and maintain bigger changes in diet and lifestyle, and to achieve better clinical outcomes and even larger cost savings in diverse groups of people than have ever before been demonstrated. Let's examine these. People often think that advances in medicine have to be a new drug, a new laser, or a surgical intervention to be powerful. They often have a hard time believing that these simple choices that we make in our lives every day, like what we eat, how we respond to stress, whether or not we smoke, how much we exercise, and the quality of our relationships, that these simple changes can make such a powerful difference in our health and our well-being, and even in our survival, but they often do. When we become more aware of how powerfully our choices in diet and lifestyle affect us, then we can make different ones. In my experience, many people are not afraid to make big changes in their lives if they understand the powerful benefits of doing so and how quickly these benefits may occur. For more than 30 years, I've directed a series of scientific research studies showing that the progression of even severe coronary heart disease can often be reversed by making comprehensive lifestyle changes. And these include a very low-fat diet such as fruits, vegetables, whole grains, legumes, and soy products in their natural, unrefined forms, moderate exercise such as walking, various stress management techniques including yoga-based stretching, breathing, meditation, and imagery, and enhanced love and social support. Our findings are giving literally millions of people worldwide new hope and new choices, options that are more caring and compassionate as well as more cost-effective and competent. More recently, we published a randomized controlled trial in collaboration with Dr. Peter Carroll, who is the chair of the Department of Urology at the University of California, San Francisco, and the late Dr. William Fair, who was the chief of urologic surgery and urologic oncology at Memorial Sloan Kettering Cancer Center. Our study showed that the progression of prostate cancer may be stopped or perhaps even reversed by making similar changes in diet and lifestyle that we showed could reverse heart disease. This may be the first randomized controlled trial showing that the progression of any type of cancer may be modified just by changing what we eat and how we live. Our research has been conducted in collaboration with the most credible scientific investigators at major academic medical centers. Our findings have been published in the leading peer-reviewed medical journals such as The Lancet, the Journal of the American Medical Association, and the New England Journal of Medicine. Research findings documenting the benefits of our program have been presented at numerous scientific meetings, including the annual scientific sessions of the American College of Cardiology, the American Heart Association, and the Society of Behavioral Medicine. I say this just to emphasize that the program described in this book has been proven to work in the most rigorous and credible peer-reviewed evaluations, and that matters a lot. I've spent so much of my time conducting scientific research because, it's important to be able to substantiate and validate whatever health promises are made. In the year 2000, I was appointed to the White House Commission on Complementary and Alternative Medicine Policy, and more than 1,000 people testified before our committee. I learned that more money is actually spent out of pocket for alternative medicine than for traditional medicine. Why? Because many people have become disenchanted with conventional medicine and they've embraced a variety of alternative interventions. Seen from this perspective, our program is one of the most scientifically documented alternative medicine approaches. It integrates the best of traditional and non-traditional approaches to health and healing. In our cardiac studies beginning back in 1977, we found that there was a 91% reduction in the frequency of angina or chest pain after just a few weeks, and most of these patients became pain-free. And these were patients with very severe coronary heart disease, many of whom literally couldn't walk across the street without getting severe chest pain and shortness of breath when they first began. After just a year, there was a 40% average reduction in their LDL or bad cholesterol levels. And this is comparable to what you can achieve with statin drugs like Lipitor, but without the costs or the side effects. In the lifestyle heart trial, there was significant reversal in coronary artery blockages in the group that went through our program after just a year, whereas the randomized control group who made more conventional changes actually showed a worsening of their coronary artery blockages. Based on these findings, we received peer review funding from the National Institutes of Health to extend the study intervention for 4 additional years. We wanted to find out if patients could continue to maintain these comprehensive lifestyle changes for a total of 5 years and what the long-term effects would be. What we found is that most patients were able to follow the program for 5 years, even though they initially had volunteered only for a 1-year study. We found that there was even more reversal in coronary artery blockages after 5 years than after just 1 year, whereas patients in the randomized control group showed even more worsening after 5 years than after 1 year, and these differences were highly statistically significant. Let's look at a representative patient in our study. He entered in 1986 at the age of 64. At that time, he had severe coronary artery disease involving all of his major coronary arteries, and he was advised to undergo bypass surgery due to the severe angina or chest pain that he was experiencing. When he entered the study, he couldn't walk more than a few steps without getting severe chest pain. But after 6 weeks, he was pain-free and he was no longer advised to have surgery. By the end of the first year, he was able to climb 130 floors a day on a Stairmaster with no pain at all. And his PET scans showed that he wasn't just feeling better, he was better. There was a 300% improvement in blood flow to his heart, and his angiogram revealed that his coronary artery blockages were reversing. He also lost 30 pounds. Amazingly, 99% of the patients on our program were able to stop or reverse the progression of their heart disease, almost everybody. We found a direct correlation between the amount of change in their diet and lifestyle and the amount of change in their coronary arteries after just 1 year and also after 5 years. In other words, the more people changed, the better they got. And this is one of the foundations of the spectrum that we'll keep coming back to. When we published our research findings, I thought these would significantly change medical practice, but in retrospect, I was a little naive. With all this talk about evidence-based medicine, we really live in an era of what I call reimbursement-based medicine. We doctors do what we're paid to do, and we're trained to do what we're paid to do. Therefore, I figured if we could change reimbursement, then we could improve both medical practice and medical education. It's not that doctors are only interested in money, but if you're paid to use drugs in surgery, and you're trained to use drugs in surgery, then it's not surprising that most doctors use drugs in surgery.
Sample complete. Ready to continue?